Welcome back to Today's Health. Today we're talking about treatment options for obesity with Dr. Zubin Bhesania. Doctor, in this segment, let's start with the sleeve gastrectomy. Can you tell us about this procedure?
Sure. The sleeve gastrectomy is a very common procedure done for weight loss. It's actually the most common procedure done in America today. And in this procedure, we are removing a portion of the stomach in order to decrease the capacity of the stomach, but we're not changing the pathway of food through your GI tract. So patients have sort of gravitated towards this procedure because it has very good weight loss with relatively low risk.
Can you describe for us what happens during the procedure?
Sure. We have another animation. And in this procedure, we once again make very small skin incisions and are able to place these small plastic sleeves through the abdominal wall. Once the camera's in position, we'll actually see the stomach, and we will do a dissection of the stomach. And the purpose of the sleeve is to remove the redundant stomach, so the capacity of the stomach is much less than normal for a person. What you can see here is this blue-colored smoke going into the stomach and how much capacity is required to fill the stomach up. When we do the sleeve, we'll actually place a sizer in the stomach to calibrate the size of the sleeve. And we have a special stapler that cuts and seals, and we divide the stomach. The portion of the stomach that's divided is removed, and what's left is a stomach that looks almost like a banana or a shirt sleeve, and that's why the term sleeve came by. It's supposed to look like a men's shirt sleeve. So you can see once the stomach is divided that the capacity is much less, but food is going through the normal pathway.
Now, what are the benefits versus risks for this procedure?
Well, this procedure is probably the most common procedure done, and it actually has very low risk compared to the bypass, for example, and has weight loss that's almost comparable to the bypass. So patients have sort of come towards the sleeve because they're getting great weight loss with relatively low risk.
Now, what is the anticipated weight loss for each of these procedures?
The procedures all have different weight losses. They all work by different methods. So in my practice, a person that has a gastric band will lose about 50% of their excess weight loss by about 2 years. That's the average. A sleeve patient will lose 65 to 75% of their weight loss after the first year, and a bypass patient will lose about 60 to 70% of their weight loss in the first year as well. Typically what happens though with all procedures, we'll have some weight gain after the surgery. So you'll lose the weight in the first year or two, and then there will be some weight gain afterwards, and that's normal. And that's where people have to control their habits and do the right thing after surgery.
Now, how do you determine which procedure is best for each patient?
Well, bariatric surgery is different than other operations. Patients do a lot of research themselves before they come see a surgeon. Most people will have their mind made up on what procedure they want before they actually come see me. Really, it's patient-driven, and my job is to educate the procedures, educate patients about the procedures so they can make an informed decision.
And again, to recap a little bit, any of these procedures will assist someone in losing weight, but what else do they need to do to ensure that the weight stays off?
So it's a great question because it's not simple. The surgery is a tool for weight loss, and you have to use it properly. So if you decide to go through weight loss surgery, you're doing a pretty big step and a big change to your body. So there are some important things that have to be done afterwards. Follow-up with the bariatric center is real important for the first couple of years after surgery. Making some lifestyle changes, making some dietary changes will all play a big role in your weight loss journey.
So it sounds like the surgery is not a fix for the obesity. It's more of a tool and a commitment to a lifelong process.
Correct. So what surgery does is give you a tool to use to be successful at weight loss.
Now, what should someone who is considering one of these procedures do to get started?
Well, the first step is to come to an information seminar, and these are held at the hospital regularly. It's given by the surgeons that perform the procedures, and that is sort of the gateway to the program. And then once you've gone through the seminar, there's a consultation phase. We have a team of people that work at the hospital. We have insurance experts, we've got the dietitians, and the nurses that all help you navigate through the system for weight loss surgery.
Doctor, this is great information. It's time for another break. We'll continue in a moment.
Thanks.